Hi, my name is Dutch Ross, and for more than 20 years, I've been advocating for affordable and accessible healthcare. Did you know that a political deal over a decade ago is still keeping your physician from owning a hospital? The deal didn't just hurt physicians, it hurt patients. In 2010, the ACA was signed into law. While many remember it for expanding coverage, few realize it also included a provision that banned doctors from having ownership or owning hospitals. This ban, called a moratorium, has been in place for over a decade, and it stops physicians from building new hospitals or expanding existing ones. The reason, given by lawmakers, they said it was to protect patients from potential conflicts of interest. The argument was that doctors would choose profits over patients if they owned the hospital. But the real reason is more sinister. It's political. The AHA, or the American Hospital Association, a powerful lobbying group, agreed to support the ACA in exchange for the moratorium. Why? Because physician-owned hospitals threaten the power of the large health systems. Physicians, they argue, shouldn't be in charge because they would put financial gain above patient safety. This narrative was pushed very hard. The AHA and others launched a marketing campaign to paint physicians as bad at business, too conflicted to run hospitals. Congress, in exchange for the AHA's support, agreed to the moratorium. So the moratorium wasn't about protecting patients, it was about protecting the pile of money that health systems make. Here's the facts. Physician-owned hospitals provide better care. The data does not support the idea that doctors owning hospitals is bad for patients. In fact, physician-owned hospitals outperform others in several key areas: fewer complications, lower readmissions, and higher patient satisfaction. In fact, studies show that physician-owned hospitals have almost 25% less complications. They're less to be readmitted. They have consistently higher patient satisfaction scores. Why? Because when doctors own hospitals, they eliminate bureaucracy and unnecessary expenses. They focus on patient outcomes, not profits. Now let's talk about the real cost of this moratorium. Over the past decade, we've seen rising healthcare prices, fewer choices for patients, and the loss of physician autonomy. Large hospital systems continue to grow, drive up prices, all while offering the same or lower quality care. Doctors are losing their autonomy. This has led to physician burnout and frustration. The moratorium is holding back innovation in healthcare, keeping doctors from providing high-quality care. So what's the solution? It's time to lift the moratorium. Physician-owned hospitals are a real solution to making healthcare more affordable and accessible for everyone. We need, after 15 years, to give doctors the power to own hospitals so they can put patients first and build systems that work. The moratorium on physician-owned hospitals is an outdated policy that hurts both doctors and patients. That's why lifting the moratorium is the top policy priority for people like the PHA, where I proudly serve. We believe that empowering physicians to own and operate hospitals is critical to making healthcare more affordable and more accessible. But I can't do it alone, we can't do it alone, and we need your help. If you believe doctors ought to be in charge of care, then join us. Share this video, spread the word, and show our elected officials it's time for change. You can visit Physician-Led Healthcare of America to learn more about these efforts or how you can get involved in lifting the moratorium. Together we can build a healthcare system that puts patients first, where doctors lead the way. Thank you for watching. Rojas out.
Very good. No problem.
That was long.